Today's episode, I want to talk about appointments, specifically veterinary appointments. And so this may have some value to you if you are in the industry, if you are a receptionist, a vet tech, a veterinarian. This also, I hope, has value to you if you're a dog owner, and it will probably have value in two totally different ways. And so, what I want to talk about today is 15-minute appointments. I want to preface by saying I am not here to convince anyone to change their scheduling or how their hospital runs. I think everyone's hospital runs with how they want it to because of their own beliefs, their own mission, their own business, their own clientele. There's so many different varieties out there. But specifically, I want to talk about 15-minute appointments. And why do I want to talk about that? Maybe you don't know. I'm Dr. Bamonte. I am a relief travel veterinarian. I have been a relief travel veterinarian for a little over 5 years now. I have practiced in several different states as a relief travel veterinarian. I have been in over 75 different hospitals. And so I've seen a lot. I've gotten to talk to a lot of wonderful pet owners. I've gotten to work with a lot of wonderful veterinarians and their support staff in hospitals and teams. And I have been in settings where appointments have been 30 or 45 minutes. I have been in settings where I have had 15-minute appointments. I've been in settings where I've had double books. And so I specifically want to talk about 15-minute appointments because I feel like there's kind of two ends of the spectrum here when it comes to appointments at veterinary hospitals and you as a pet owner, and you probably have no idea if they're a 15-minute appointment. All you know is you're told to be there at a certain time. Hey, your appointment with Champ is at 9 a.m. on Friday. You show up at 9. You don't know anything other than you're seeing the veterinarian for whatever reason it is that you scheduled. And so what I'm not talking about here, I'm not talking about tech visits. So you may schedule an appointment with your hospital, your veterinary hospital, and you may schedule a tech visit, meaning you're not seeing the doctor. You're there for a nail trim or anal glands or a vaccine booster or blood work or a sample, what have you. I'm specifically talking about appointments where you are seeing the doctor and 15-minute appointments. Again, if you're a dog owner, you probably have no idea that they're 15-minute appointments. And so 15-minute appointments I have seen are often established. They're often the status quo for hospitals where they do a high volume, where they're trying to serve as many pet parents as possible. They are not always low cost, but they can be low cost. And so their mission and their vision is how can we help as many people as possible? How can we get as many people in the door to help them with their issues and be affordable to them? And I will tell you that I have started to kind of steer away from doing shifts at hospitals like this. And it's not because of anything bad, but it's more so I find that I am not set up in a way because of time and the amount of patients that need to be seen and keep things flowing, where I'm able to educate in detail where I feel like it's appropriate and where I want to. And now, not every patient and every pet owner needs detailed communication, detailed education, because it may be very simple. They may be there for an exam and a few vaccines. There's no concern. Their pet looks great and we can move on. And we talk about, hey, what are you doing? And here are some things that either keep doing this because it's great or what could we do better? I specifically don't really like the idea of 15-minute appointments when it comes to sick patients. And the reason is that there's just not enough time. And so we have to really strategize on how we are tailoring that appointment so that we can keep the flow going so that clients aren't sitting there for 2 hours and they aren't getting disgruntled. And here's the thing is when you make an appointment, I can't speak for everyone, but for me, I know that you're making that appointment and you likely have to be somewhere. You're likely coming from somewhere and you have to be somewhere. And so I want to be mindful of your time, but also make sure that you're getting what you paid for. And so you finally get the vet appointment. You make it. You finally remember to, or you're finally able to get in. You've got questions. Your dog is itching. Your dog is having urinary issues. Your dog is slowing down. They're having trouble getting up. They're pacing at night. You want to talk about their food. Hey, I saw this supplement on Instagram. Is it really worth it? Or my dog, is barking oddly. You want to talk about it. But I don't know, 12 minutes into your appointment, you're being handed a receipt or you're ready to check out and you're like, I didn't really have enough time. And you can see maybe the expression on your vet's face that they know they don't have time. They really want to talk to you. And so it's not that your vet doesn't care. It's not that the vet tech doesn't care. It's not the receptionist doesn't care. They do care. In fact, they care so much that they're trying to see as many people as possible. It's just the system isn't built for that kind of structure when it's 15-minute or even 20-minute appointments. It's not built for that. Now, sometimes are there 20-minute follow-up appointments that work? Absolutely. You come back in for recheck urine or recheck ears, and you're happy with how things are going. And we retest, maybe we recheck the ears under the microscope, or we get a urine sample and reanalyze it. Everything looks great. Those 20-minute appointments are great. You're in, you're out, you got the affirmation that all this is clear, you're in the clear, your pet is in the clear, and you move on and you're like, that is behind us. It's not always the case though. Especially in my opinion, people that are coming back for follow-ups are coming back for two reasons. One, things have not gotten better. Actually, I would say three reasons. Things have not gotten better. Two, things have gotten better, but because this happens all the time, they're worried, and so they want the affirmation it's better. Or three, they have been sold on the value of coming back for a recheck to ensure that whatever that is completely resolved and not just better, but gone. So that way it doesn't linger and show back up in 4, 6, 3, 9 weeks, whatever have you. And so when it's 15 or 20-minute appointments, the system's just not built for that type of communication, that type of in-depth care. It's built for efficiency. And that's where things can go wrong. Those are built on efficiency. You're in, you're out, there's no questions. There's very little education that has to happen. There's very little discussion. You get the service, you get the product, and you move on. And you move on to the next patient. Unfortunately, both sides have probably, whether you're in the veterinary industry or you're a pet parent, you've seen it happen. How many of us in the industry have gone in, have seen an appointment that's there for vaccines or annual exam or blood work, something preventative care, wellness care, and either if you're a vet tech, you go in and get a history, or if you're a veterinarian, you get the history from your vet tech, and they're here for that. But oh, by the way, they have these horrible sores, or they're lame, or they're limping, or they're not eating as well, or we noticed they lost a lot of weight since their last visit, and the owner hasn't been trying to, or they've gained a lot of weight and nothing has changed. These things can pop up, and so that's where things go wrong. And so that's why I know sometimes we think of, okay, well, it's the average. Most of the patients will be okay. And so the ones that aren't, we'll go over, and the ones that are, we'll save time on those, and we'll be efficient, and we can use the time from those patients to add on to the ones that go longer. And so that is where we get limited. And I'm not blaming anyone. This is not a blame. This is just being factual. And I can say it because I have been in these hospitals, and now I try and really check myself when I see these shifts become available, or I'm asked to work these shifts, is that for the way I like to educate pet owners, and it's not that I need to be in there for an hour, but being able to educate them for why they're there, and hey, your pet is here for this. I know this isn't what we're talking about, but we can also talk about these other things to help your pet do better, live better, less visits. And so educating them on that. And so often 15 or even 20-minute appointments are often double booked. Not always, but often double booked. And so you've got a team that's being split, and not that they can't multitask. I think the veterinary industry has a lot of wonderful individuals that can multitask. I think that's one of the great qualities of the industry. But sometimes our communication can suffer because of it. And so the focus, in my opinion, on these kind of 15 or 20-minute appointments is usually vaccines or urgent, where it's like, can we stabilize them? This isn't an emergency. It's something urgent that needs to be addressed. And so we see them, we get them in. We want to facilitate them being seen, and we want to offer these openings. And so there's often with these appointments, there's no time to go into a full dietary or nutrition discussion or questioning or educating. There's often no time to hold space for behavioral questioning, discussion, education. There's often no time for environmental discussion, education. We just don't have the time to talk about those things. And those things seem small, in comparison to the dog who's there for the diarrhea that's been going on for 3 days and now it's bloody, or the ear, and now the dog is getting an ear hematoma because it's shaking and scratching its head so much. I get it. We have to put out the immediate fires, but can we also talk so that we are preventing other fires with the food, with the supplements, with the lifestyle, with the inflammation? So that way we can help our pets live better, help our patients live better and longer. And so what can happen sometimes is that either clients will feel unheard because they had a lot of issues and they got more superficial information given to them, or you didn't have enough time to think about the questions that you wanted. And this can even happen. I'm not saying this can't happen in a 30, 40, or 45-minute appointment, that you can't think of things and you think of them later, or that not everything was discussed. It's just more likely to happen in these 15 or 20-minute appointments, especially when they are double booked. And then the veterinary team, can easily get burnt out with this. You can easily be seeing 30, 35 plus patients a day. In fact, it was sometime this year, I want to say it was March. I worked at a hospital, and I don't think that I realized that they were 20-minute appointments. And I got there, I ended up seeing, I think, 29 appointments that day, which is not the most I've seen in a day. And the only reason it was 29 and not like, I think it was supposed to be 34 or 35, is that there was a few no-shows. And I think that was what had happened, is there was a few no-shows that had happened. And so that's a lot of client communication. That's a lot of responsibility. That's a lot of medical documentation that has to happen. And that's a lot of answering. That's a lot of educating, a lot of discussing, a lot of informing. And so a lot can get lost in the why. Why is your dog's skin flaring up? Why is your dog having diarrhea? Why is your 9-year-old male dog having a random urinary tract infection? Rather than let's treat them and okay, let's move on. Like, let's discuss what could have set them up for this. Because yeah, do those things happen? Absolutely. Does a 7-year-old dog just get diarrhea out of the blue? Yeah, it happens. But why? Why? Like, I feel like we're missing the clues on the body telling us something is going on, whether it's because something that happened in the past, because has this dog been on a slew of antibiotics and there's been nothing to help repair the gut. And so now we're seeing the effects of it. Is there something else going on? Is this 9-year-old dog who's having urinary issues for the first time that's never happened before? Does this dog have a bladder stone and we're just so quick to get a urine sample, put it on antibiotic, whether we see bacteria or not, and then move on? And so why is this dog slowing down at just 6 years old? Why is the owner noticing that they're slowing down? They don't want to go on their walks, or they've lost a lot of weight, or they've gained a lot of weight, and then getting the history on that. Why are they fine on the blood work? Everything looks normal, but something is still off with them. And so when we don't have the time to discuss this, we can miss the gap on getting ahead of certain things. Yes, putting the fire out now for what they're there for, but how can we prevent fires for the future so that these pets can live better, so that they can live longer? And so again, this is not to put shame on these appointments. Again, a lot of these hospitals have a good mission and they want to be able to provide value, maybe to underserved areas or at a lower cost, or they just have a heart to help as many people as possible. But you want to be heard without judgment. You want to understand your options. You want to be able to talk about food and supplements and home environment. You want your vet to be a partner, right? Not just a prescriber. Because when you have a partner with your vet, you guys can be a team to help your pet live better. And so I know that pet parents aren't asking for miracles. Sometimes you guys do, and we try our dangest to do them. Sometimes we can. But what's really important is meaningful conversations, impactful conversations. It doesn't necessarily have to be in depth or in length, but providing the detail, providing you so that you can be informed, so that you can influence your pet, your dog or your cat with positive influence because you're educated. So you're not having to go to the internet for every little thing. And then when you present that at the vet saying, oh, I Googled this, and then how many times have they like given you the look like, oh, Dr. Google? And it's like, well, what are we supposed to do for these clients when they're only getting 15-minute appointments? That's not 15 minutes with the doctor. That's your appointment slot. And so we also, and I'm speaking to us in the veterinary industry, we can't be upset then if these are the type of appointment times we're going to hold, and then our clients are going to go to Google and they're going to present us with the information. We can't get frustrated then. That's not fair to either one of us, to them or to us. And so there is a downside to it. The upside is, yes, you get to serve so many pets and so many pet parents that probably maybe would have had to wait weeks somewhere else. Also, are we able to educate them and inform them and not just treat the fire that they're presenting, but prevent fires? Are we able to do that for them? That's where I come in. And I say, I think that we have to uphold the standard, and not that you can't uphold the standard with 15 or 20-minute appointments, but set the expectations. Maybe that comes with setting the expectations when they're setting the appointments. Hey, letting you know your appointment is set at 9. It is a 15-minute appointment. We are only going to be able to address the vaccines today. We're only going to address the ear issue. That way your expectations are being met. That way you can go in and maybe you make the appointment. Okay, you know what? I hear that, but actually I have other questions. What's the best way to do it? Is it still this 15-minute appointment? Okay, then you know going in that maybe or maybe not all those things are going to be met. All those expectations are going to be met. All those conversations are going to be had. And so that's why I wish that more hospitals offered longer appointments. In my dream world, I would say wellness visits should be, and true wellness, and this is where we get better as an industry about asking the right questions when we're scheduling appointments. Hey, I see you want to bring Coco in for vaccines. Is there anything else going on right now? Any issues with her skin or her stool or anything? No, great. If anything pops up, let us know so we can adjust your appointment time. Oh, there is other stuff going on. Okay, well, let me find a different time slot for you so that we can make sure we have enough time to do that and talk about things you're concerned about. To have that dedicated time. Because here's the thing is when we have that dedicated time, we actually can serve our clients better, in my opinion. Doesn't mean my opinion's right or wrong. We can serve our clients better. We can do the better workups. We can get them the really tailored, personalized medications or supplements or therapy protocol. We can deep dive into your pet's story, their history. Okay, if they're having chronic ear issues or skin issues or diarrhea, let's look at their whole past up until this point. Their lifestyle, their diet, their stress, their antibiotic use, their supplements. Let's talk about what really matters and what doesn't. Because we have to be able to meet your goals and your pet's goals. We want them to have more energy and fewer meds and long-term wellness. And I'm not saying that 15 or 20-minute appointments can't hold space for that. It absolutely can. I think that where it comes in, if we're going to keep doing this as an industry, and I've seen some corporates go to this model, they're trying to get more people in the door, is I think this needs to be better explained to pet parents when they're making these appointments. I don't think we need to gatekeep it. And while, yes, I know when I go to my doctor, I don't necessarily know how long my appointment is, but I know that I'm going to be served in the way I want to. I'm not going to feel rushed, and that's why I see the doctors I do. That's why I see all my doctors the way I do. All of them. Because I've never felt rushed. I've always felt that they've taken the time for me. But also, I think that pet owners also translate the care that they get as a human, and they translate it to what they're going to be getting for their pets, and they think they're going to have the time. I don't think it's wrong to be like, hey, how long is this appointment? Is this is my appointment at 9 is supposed to end at 9:30? Is this, or maybe we do better as an industry educating, hey, just letting you know this is a 15-minute appointment. And what that means is that we're going to be efficient and try and get you in and get you out. And we have you scheduled to have Toto's ears looked at, just so you know if anything else is going to need, if there's any other concerns that you have, we're going to have to be able to just focus on Toto's ears this time. If you want to focus on anything else, we invite you to either, and I don't know, it depends on the business model. Is it schedule another appointment? Is it you just are there longer? That depends on the hospital. I've been at hospitals where they only talk about what is scheduled and that is it. You have to make another appointment. And I've been at hospitals where it's like, no, you talk about whatever, but then you fall behind. And then you have clients that are frustrated. You have staff that is stressed. You have things that get missed, things that get rushed. In my opinion, that's when more mistakes have the opportunity to happen. I'm not going to say that's when they happen. They have the opportunity to happen. And so this is not about replacing your veterinarian by any means. It's about expanding on the care team that is helping you and your pet. And it's having someone who gets your goals and helps you get there. It can be with traditional, it can be with non-traditional, it can be a blend of both. That's why in an ideal world, I would probably have 30-minute wellness visits, 45-minute sick exams. Likely. Not to say that I wouldn't have the occasional 20-minute follow-up pending the patient and what we're rechecking, and clear communication on what is expected in this recheck. and that it is just this. And it really depends. If I'm rechecking a patient that has had excessive vomiting and diarrhea and not eating well, like something very complicated, I'm not going to put them in a 20-minute appointment. I don't think that that's setting them up correctly to really support them and them have my attention and me have their attention and to not feel stressed, to not have my team feel stressed. And so I can think of several situations where I have seen patients and their owners, and they have come from hospitals that have had shorter appointment times to triage more patients during the day. And some things have been not talked about. I don't want to say missed, because I don't even know if they were talked about. I think I can think of one patient in particular that I had treated for heartworms. This was years and years ago. And this client was under the impression that the flea prevention she was given was also heartworm prevention. She said, and you could see, and I could see it on the receipt, she bought it religiously. And she's like, I was always told it was. So somewhere along the way, there was a gap missing. Now, was it because this hospital was trying to triage too many patients? I don't know, but it was a hospital that had that kind of business model. And so I'm not sure where the missing gap falls for that. And can that happen in a hospital that has 30 and 45-minute appointments? Absolutely. I'm not saying it can't. And so when you are able to hold space, you can get to the root cause. For this dog that is constantly itching and the owner just wants steroids, you want steroids. Your dog is on Apoquil, and you refill prescription after prescription. When you have the time, you can talk about your dog's gut and detoxing and supporting it and maybe getting them off the meds and what that looks like. And so that starts with us being able to hold space and hold time to really have those in-depth conversations. So it's not just a treat and straight. So it's not just a, hey, let's put this fire out, but we'll deal with the other fires when they come. How about we put this fire out and we try and prevent other fires too? These aren't common things that you'll have in the 15-minute exam room. And those are the ones that are going to change the lives. So if you've ever walked out of a vet visit feeling more confused, feeling more unanswered, feeling more unclear, and maybe not cared for or not having things addressed, you're not alone. It happens. And I will tell you that your veterinary team is there they want to help. Sometimes the system is just not built for what you're needing at that time. And you're not wrong for wanting more. And if you're in the veterinary industry, you're not wrong for wanting more time with your clients. You're not wrong for wanting to be able to hold more space for them. So if you want to go deeper, I invite you to do a one-on-one nutrition or lifestyle consultation where we'll get into everything that is going on in your dog's body and they're trying to tell you. And I invite you to have a discussion with your veterinary team, like the receptionist, and inquire. Be like, hey, my dog has got these issues going on. Is this going to be enough time to discuss it in this appointment? If not, I'm happy to make another one. That way, everyone's expectations are being met, and your veterinary team can, at the end of the day, feel so good about the care that they've given. I look forward to the next one with you.